welcome, Jinesh.
Thank you.
Thank you for coming in for the interview today and for discussing why you came to Australia and also giving us some of your background. So I'd like to invite you to please tell us about your background and what made you choose Australia.
Thanks, Rosalind. Well, first of all, I will introduce myself. My name is Jinesh Kumar, and I work as one of the clinical nurse consultant in a tertiary hospital in Perth, Western Australia. I am from India, Kerala, and then I worked there as a nurse over there for 3 to 4 years' time. And then, of course, I decided to advance my career, and I was looking for a developed country, either it could be UK or US or even Australia. And the decision why I decided to choose Australia was that because Australia is a land of opportunities, especially for the nursing career.
Jinesh, can you tell us why you chose the Institute of Health and Management to undertake your bridging course?
Hence, I decided to move on to Australia. Part of that, you got to follow up certain process to get in touch with the Australian Registration Authority. So I had to do some research around that, and then you got to think about which college that you got to do this bridging program, which we normally say, because it's like a short course which they actually look into yourself, your skills, your competencies, whether you are a good candidate to give the registration in the Australian Registration Authority to work as a registered nurse. So obviously I was in the process of searching for the best college which I can get this course completed. And it's really hard for the candidate when they had to get in touch with the certain colleges to know which would be the best options for them. And of course you Google it, you go through their reviews, and then do you see which would be the best college for them. And it wasn't that hard for me because the experience which I had come across with in the campus, and because initially you get a warm welcome to the campus, and then all the faculties that you come across with in the IHM was fabulous. The exposure which every single candidate that they received in regards to their theory sections, their lecturers, and of course the practical aspect which I go through it before you even go to the clinical placement was something which is great, which even mold you as a person to think about how the Australian healthcare setup works different to what you practice back home. It doesn't matter which country you come from. So the experience which you get from the institution, from IHM, makes you feel like you are confident enough to jump into the healthcare system of Australia, and then that helps you a lot when you go for your clinical placement. That makes you feel confident when you do a specific nursing procedure. And of course you have the best educators even up in the area where you normally go part of your clinical placement. They support you, they help you, and they guide you with anything that you come across with as a student. I also want to talk through about the simulation training which we normally get exposed with before you go to the practical environment. That makes you feel like you are competent in that particular skills, and then that helps you a lot in enhancing your competencies. The other thing which I want to highlight is about the specific location of the campus, which is easy to reach, easy to get into the campus using public transport. Because when you are a student, you probably you completely rely on the public transport system, and then the campus is located in an area where it's easy for you to get into on time.
Did the simulation experience in the classroom setting, was it when you actually got out into the health setting and practice?
Yeah.
Did you ever come across any of those examples that occurred
Yeah, absolutely. It was a good question though, because the certain simulation training which you get it from here, it's actually happened in the real environment. So for example, you have an experience around how a cardiac arrest occurs in a simulation training, and you have the correction, and then you get the best training from the educators in here. And then when you go for your practical environment, it did happen. It did happen many times to different students as well, which I would say, like, some of the students had the great opportunity to work in the same hostel just because they perform really well, because they had the best training from the simulation itself that actually helped them to get a job in that particular ward, just because the faculties over there, they like the way which they have done that particular scenario. So obviously it helped me a lot as well, because in here we look for patient-centered care. So anything and everything that you deal with the patient, you gotta make sure that the patients are involved in that process. Like, you get the permission from them, you make sure that they are okay with that procedure. All those things matters. And then when you come to do a procedure on a patient, if we get sort of a simulations that highlights around what are the pre-requirements, what are the pre-educational stuff that you need to come across before you start a procedure, which is all being highlighted in the simulation settings, and that helps you a lot, because at the end of the day you want to practice as a safe RN, I would say. So to do that, you definitely need simulation training.
Jinesh, would you be able to tell us what you would recommend for your colleagues back home? So what is it that you would say to them if they tell you that they wanted to come to Australia to study?
Well, definitely I will recommend Institute of Health and Management. Like the way I said before about the faculties in here, about the admin staff in here, and about the way which they look after their students. So when you come to Australia as a brand new person, you don't know where to go next, or how to enhance your career, or what is going to happen to my professional career in the future. I would say IHM would be one of the best places that you could get the best experience, and that will definitely make you a perfect nurse.
Thank you, Jinesh, for coming in today. It's been a pleasure listening to your story.
Yep.
It also is great for me as a lecturer to hear that your progress, and also to hear that you have succeeded to a management level in such a short time. So well done.
Thank you.
And what I'd like to do is just advocate for Institute of Health and Management for international students who would like to do a bridging course or postgrad course. We have a fantastic course here, and the lecturers are all committed. So we welcome you to the Institute of Health and Management. We wish you well in your future directions that you take, wherever those directions take you. And if you come to the Institute of Health and Management, we will support you in achieving the dreams that you want to achieve in your nursing profession.